Hi, I'm Dr. John Horstkamp. I'm sorry I couldn't be with you at the men's wellness meeting today, and I hope you're enjoying it. Today I wanted to talk about high blood pressure, why it's important, what it is, what we do for it. But first I wanted to just give you a little bit of information about myself. I've been here at NIMIPU since February of this year, February 2022. Before that, I worked at Pullman Family Medicine, and then before that, Student Health at WSU in Pullman. I went to medical school at UCLA and did my residency at UCLA. That was a long time ago. And I'm married to Dr. Aurora Horstkamp, who is also working here at NIMIPU, and we're both very glad to be here. So today's topic is high blood pressure, what it is, and why it's important, what we do for it. The terms high blood pressure and hypertension are synonymous, they're the same thing. And basically what they refer to is increased pressure within the arteries. High blood pressure has been called the silent killer. Most folks who have high blood pressure don't have any symptoms, at least initially, but over years it can cause significant damage to the body. So it's important to diagnose it and to treat it. So the three major organs affected by high blood pressure are the heart, the brain, and the kidneys. As far as the heart goes, there are two main problems that people with long-standing high blood pressure can get. First, they can get what's called heart failure. Now, heart failure is not a heart attack. It is a situation in which the heart does not pump blood well enough to meet the body's needs. And that typically occurs in people who have had high blood pressure for many years, sometimes decades, usually uncontrolled high blood pressure. People with heart failure feel very bad typically. A lot of times they have fatigue and decreased exercise tolerance. Sometimes they're very short of breath, even at rest. And a lot of times they can have swelling, particularly in the legs, sometimes even in the lungs, which is called pulmonary edema and can make people very short of breath and very uncomfortable. Treating high blood pressure significantly decreases the risk of heart failure by 50% or more. The second type of heart problem that people with high blood pressure can get is heart blockages. Now, a heart attack is a type of blockage in which the arteries that go to the heart and actually supply the heart muscle with its own blood, those arteries get damaged, and then a clot occurs on top of the damaged artery, and that cuts off the blood flow to the muscle downstream. The muscle dies, and that's a heart attack, which, as you know, is a very serious problem. Sometimes people with heart blockages don't get heart attacks, but get what's called angina. Angina is a syndrome in which people typically feel short of breath, or they get chest pain or pressure, and those symptoms go away with a little bit of rest. People with angina are at markedly increased risk of heart attacks. So again, the heart is probably the single most important organ that can be affected by high blood pressure, and heart failure and heart attacks are the two real things that we worry about. The second organ that is affected by high blood pressure is the brain. And people with high blood pressure can have strokes. Now, a stroke is like a heart attack, but in the brain. Essentially what you have is you have damage to the artery, and then you get a clot on top of the damaged artery. It cuts off the flow of blood downstream, and that causes death of the brain tissue. And as I'm sure you know, strokes can be very devastating. A second type of stroke that people can sometimes get is what's called a hemorrhagic stroke, where damaged arteries, and the arteries were damaged due to the high blood pressure typically, can actually rupture, and you can get bleeding inside the brain. And that can be very serious and actually even fatal. So the third major organ affected by high blood pressure is the kidneys. The kidneys, as you know, is a filter. It basically filters the bad stuff out has the bad stuff go out in the urine, and the good stuff like protein and potassium kind of stays in the body. The kidney actually consists of innumerable numbers of tiny little filters called nephrons, and those nephrons can be damaged by high blood pressure over time. And so what can happen is the good stuff like protein, stuff that the body wants to hold on to, can get spilled out in the urine. Over time, high blood pressure can result in deterioration of kidney function and sometimes even kidney failure, requiring dialysis. Now, other conditions, including diabetes, can contribute to that. So it's really important to control both blood pressure and diabetes to protect the kidneys. Okay, so how do we define high blood pressure? Well, pressure in the bloodstream is defined in millimeters of mercury. We could have used pounds per square inch or something like that, but for historical reasons, doctors use millimeters of mercury, which is what kind of shows up when we use the cuff to measure the blood pressure. There are two measurements that we use. There's the top measurement, which is called the systolic, and that is when the blood is being pumped out of the heart, when the heart is contracting. And the bottom number, called the diastolic, is when the heart is relaxing and letting blood back into it. So we divide blood pressure into four main types. First, there's normal blood pressure. Now, normal is less than 120/80. So that's an important number to kind of keep in mind for doctors, at least, 120/80. And then there are people who have what's called elevated blood pressure. Now, elevated blood pressure, the bottom number is less than 80 and the top is between 120 and 129. Then there's what's called stage 1 high blood pressure, and then stage 2. Stage 1 high blood pressure, the top number is between 130 and 139, and the bottom number is between 80 and 89. And then finally, there's stage 2 high blood pressure, where the top number is greater than 140, greater than or equal to 140, and the bottom number is greater than or equal to 90. So I know that there are a lot of numbers there. The ones that are most important for doctors to keep in mind are normal, which is less than 120/80, and stage 2 high blood pressure, which is 140/90 or more. That last number is important for us because that number is where we typically are really going to want to put people on medication. People who have elevated blood pressure or who have stage 1 high blood pressure, a lot of times we do not put those folks on medication unless they have other significant risk factors for heart disease or stroke. Things like smoking, positive family history for heart disease or stroke, high lipids, or diabetes. There's also a problem called white coat hypertension. You can see the white coat. White coat hypertension refers to a situation where people, most of their lives, as they're going through life, when they're at home and at work and so forth, they have normal blood pressures, but when they come to the doctor's office, the blood pressure goes up. The doctor's office can be a stressful situation for people, sometimes even for doctors. And so if the blood pressure is elevated in the doctor's office but is normal at home, we don't treat that. That's not abnormal. The way we typically get a handle on that is we have people measure their blood pressure with the nurses at a pharmacy or at home. Risk factors for high blood pressure. So there are about 6 main risk factors for high blood pressure. The first is age. As people get older, their blood pressure increases. And there's not much you can do for that. If there was a pill to stop aging, I'd be on it myself, but unfortunately there isn't. The second is family history. If you have a parent or a brother or a sister with high blood pressure, your risk of getting it doubles. The third risk factor is being overweight or obese. People who are heavy have a higher risk of high blood pressure, and losing weight, of course, can decrease the blood pressure. The next is lack of exercise. People who don't exercise have an increased risk of high blood pressure, and that's independent of weight. So in other words, if you are overweight and lose weight, you can still get more benefit in terms of your blood pressure if you go from non-exercising to exercising. The fourth risk factor is a high salt diet. People who eat a lot of stuff like chips or who salt their food have an increased risk of high blood pressure. And then the final risk factor is alcohol overuse. Alcohol overuse is generally defined as more than 2 standard size drinks per day for men and more than 1 per women. And when people have alcohol overuse, cutting back on the alcohol will significantly decrease blood pressures. Most high blood pressure, 90% of the time, is what we call essential hypertension. And that is the type of high blood pressure where folks are older, or they're overweight, or there's a family history. It's kind of the standard high blood pressure that we see all the time. But a small percentage of people have secondary hypertension. That is high blood pressure that is caused by a specific factor. And some of those factors include steroids. So a steroid medicine like prednisone that sometimes folks with chronic arthritis or chronic kidney disease will be on, that can cause high blood pressure. In certain susceptible individuals, not many, but in certain susceptible individuals, people who are on non-steroidal anti-inflammatories like high-dose ibuprofen can cause high blood pressure. Sometimes an overactive thyroid can cause high blood pressure. Sometimes people, rarely, but sometimes people will have problems with their adrenal glands that can cause high blood pressure. In addition, sleep apnea can do it. So these are various things that can cause high blood pressure that are not the usual type of high blood pressure. When people have that and we identify it, we try to modify those factors to get the blood pressure back where it should be. Now, diagnosis. The way that we diagnose high blood pressure is with a set of measurements. I like to have at least 6 to 12 measurements, various times of the day, various places. Sometimes it'll be in the doctor's office, but sometimes at home. You could also get blood pressure checks with the nurses or blood pressure checks with various pharmacies. Those sorts of things can be helpful too. We don't generally make a diagnosis of high blood pressure based on one measurement, because just about anything, not getting enough sleep, having too much coffee, what have you, stress can cause a transiently elevated blood pressure. So what we like to do is we like to get several measurements. If the doctor thinks that you have high blood pressure, what we'll typically do is we'll bring you into the office and we'll do a history and physical and some lab work. So the history really focuses on things like your family history, your habits. Do you exercise? How much alcohol do you drink? What's your diet like? A physical examination usually is going to include, of course, a blood pressure measurement, but in addition, we'll focus on the lungs and the heart. Those are the organs that are typically most abnormal in terms of physical examination in people with long-standing high blood pressure. We'll do blood work. Generally, we'll check things like electrolytes. We'll check your kidney function. We'll check for other risk factors like diabetes, and we'll check for high cholesterol, high lipids in the blood, which are also risk factors for cardiovascular disease. I will also check thyroid function because, as I said, sometimes folks with an overactive thyroid will have high blood pressure, and if you correct that, the high blood pressure will go away. Doctors will also do urine tests. What we're looking for there is evidence of any damage to the kidneys from long-standing high blood pressure, or from anything else for that matter, like diabetes. And then finally, a standard test for folks with high blood pressure is an EKG. The EKG is an electrical test where the nurse puts electrodes on your chest and we measure your heart's electrical waves. And that can give us information on such things as evidence of an enlarged heart, which can happen in folks who have had high blood pressure for a long period of time. We're also looking for rhythm disturbances or any evidence of a previous heart attack or any evidence of decreased blood flow to the heart. Okay, so how do we treat high blood pressure? Well, it really depends on the stage. For most people with elevated blood pressure or with stage 1 high blood pressure, we're not going to put those people on medications. Some people with stage 1 high blood pressure will be put on medicines if they have other risk factors. So for example, if the person is a smoker, if the person is a diabetic, the person has heart disease or a strong family history of heart disease, we might put those people on medicines because we want to get the blood pressure down to decrease the risk. But most of the time, if the blood pressure is less than 140/90, the treatment initially is going to be with lifestyle modification. And lifestyle modification consists of several things. First of all, there's the diet. If people are overweight or obese, we'll sometimes have them talk to the dietitian about weight loss. We'll also talk about a low sodium diet or a so-called DASH diet. DASH stands for Dietary Approaches to Stopping Hypertension. Basically, staying away from things like sugary drinks and a lot of red meat and eating a lot of fruits and vegetables. Those sorts of measures can decrease blood pressures both on the top measurement and the bottom by up to 5 points. It can make a big difference. Exercise, same with exercise. Standard exercise for most folks is 30 minutes of moderate exercise most days of the week. Again, if people are sedentary and you put them on exercise, you can drop the blood pressure by 5 points top and bottom. Smoking cessation. Smoking is another risk factor for heart disease, of course, and so we're going to want to work on that. If a patient is a diabetic, we want to get the diabetes under control, because diabetes and high blood pressure kind of act together to increase risk. Alcohol, people who are drinking more alcohol than they should, cutting back on the alcohol, again, it can decrease the blood pressure by 2 to 5 points or more. So that's kind of how we treat folks if we're not going to use medicines. Now, if people have stage 2 hypertension, 140/90 or greater, and by the way, you don't get partial credit for blood pressure. If either number is abnormal, the whole number is abnormal. So if your bottom number is 90 or greater, or if your top number is 140 or greater, we're gonna probably want to treat you with medication. And there are 4 main types of medicines. The first is a diuretic, a so-called water pill. Common diuretics would be hydrochlorothiazide, chlorthalidone. Sometimes we'll use spironolactone. That is a first-line medicine. There are medicines that are called ACE inhibitors that really work on the kidneys. One that I prescribe a lot is called lisinopril. Third class ARB medicines, one is called losartan. Those also work on the kidneys. The fourth type of medicine would be a calcium channel blocker. To some extent, it's doctor and patient choice on which of these to use. My go-to is usually lisinopril. The medicine's been around a long time. It has minimal side effects. It's very safe. But again, you and your doctor or nurse practitioner will decide on what to use. The ARBs and the ACE inhibitors, we really want to use those in folks with high blood pressure who also have diabetes. The reason is that those medicines protect the kidneys in diabetes. Most people who wind up on medicine for high blood pressure require more than one drug. Most people require 2 drugs, and some people require 3. So if for example, I start a patient on lisinopril and the blood pressure is better, but it's not where we want to be, I might add a diuretic or a calcium channel blocker. There are a couple extra types of medicines that we sometimes use. One that you might have heard of would be a beta blocker. Metoprolol is an example. Those medicines back long ago when I started out were first line, but now they're no longer first line, mainly because of potential side effects. But metoprolol and other beta blockers are really good medicines for people with heart disease. So if you have heart disease in addition to high blood pressure, most likely you'll be on a beta blocker, perhaps with one of the other types of medicines. 2 other classes of medicines are alpha blockers and vasodilators. Long ago, we prescribed those medicines a lot, but nowadays we don't prescribe them very much, except in people who just don't get better on the other sorts of medicines, mainly because they have adverse side effects. So what's the goal with high blood pressure treatment? For most people, it's less than 130/80. If, for example, we take a person who starts at 150/100 and we bring that person's blood pressure down to 130/80, we will decrease the risk by more than 50% of having a stroke, of having a heart attack, of having kidney problems in the future. Some people who don't have other risk factors, who are relatively young, relatively healthy, no family history, not smoker, cholesterol okay, will bring the blood pressure not down to 130/80, but maybe 135/85. But with me, I generally like to get the pressure lower if I can and if the patient is not having side effects. In terms of follow-up, when you have high blood pressure, initially there's a lot of activity. The doctor's going to do blood testing and urine testing and so forth, as we discussed. Some of the medicines, like for example the water pills, can decrease the potassium in your blood. So a lot of times the doctor will order some blood tests once they put you on that pill, or if they adjust the dose. But eventually things get stabilized. Eventually your blood pressure will be where it should be. At that point, I generally see the patient every 3 to 6 months. Frankly, most of the time in people with good control of high blood pressure, it's an every 6-month visit. Usually don't let it go every year because a lot can happen in terms of the health within a year, but around 6 months. So you don't have to be in the doctor's office all that much. Well, thank you very much for listening to my talk on high blood pressure. I hope you enjoy your Men's Wellness Day, and if you do have high blood pressure, get it taken care of to protect your brain, your kidneys, and your heart. Thank you very much. This was Dr. John Horstkamp. Take care.